So we know lung conditions disproportionately affect some of our poorest communities in the UK, particularly in England. We know there are around 3,000 patients across the east of England that have interstitial lung diseases. So the project was designed to increase access to care for those patients in our region who aren't able to get to the Royal Papworth currently. Our patients talked to us and told us that it was really difficult to access care, pathways were fragmented and there wasn't equitable access to care across the region. We listened, we worked with some voluntary sector partners and identified that some of our patients were travelling up to 2 hours to access care. Setting up the virtual MDT was a way to create a service where patients didn't have to travel but could still access expert care and attention from our local specialist hospitals. So that was an opportunity to test and scale a new model of working for the region. The virtual MDT we set up with the NHS England Clinical Respiratory Network and the Royal Papworth Hospital is a project to improve access to care. It brings together groups of specialist clinical physicians to help improve the diagnosis, management and treatment of patients with suspected interstitial lung diseases, ILD as they're known. The impact's been phenomenal. We're really delighted with the way that the teams have come together, both acute hospitals in our region and the specialist hospitals. We believe we've seen around 150 patients who have now got a new or defined diagnosis off the back of this virtual MDT. They may have got access to new treatments or new methods of care as a result of that. So we feel it's been a really effective project, very, very patient focused.